facing head-on the emotions beneath the surface as we bridge from an old world of confusion and lack to a beautiful new world of freedom, abundance, and love with straightforward truth and inspired hope is what you'll find on The Charla Anderson Show. Collector and connector of fascinating people. And everyone is fascinating. Here's your host, Charla Anderson.
Good, beautiful day, beautiful, beautiful souls. This is Charla Anderson, host of the Charla Anderson Show, collector and connector of fascinating people, and everyone is fascinating, especially you. So grateful to be on this Win-Win Women platform and podetize with streaming services all over the place with this Charla Anderson Show. Who knew? And we're just getting started, and I'm grateful, and I'm always honored if you choose to take a moment and listen to the hope and the encouragement that I choose to bring to the network out here. So as my standard practice is, at the beginning of my show, I always like to take a 22-second, a little mini meditation just to get us grounded and centered. And I would love for you to join me. Soon after that, we'll have our conversation with Dr. Joanna Carmichael, and then we're going to have a great time. So first, we're going to take 7 seconds of breathing in calm. We're going to hold it for 4, and then breathe out gratitude for 11 seconds. So we got just a small moment to get ourselves centered. Ready? Will you join me, please? Hold. Release. Thank you, thank you, thank you, thank you, thank you. Wow. So I do believe that busy, busy, busy days, that's not a bad thing to do multiple times a day just to get grounded and centered, especially if you're hugging a tree or something and walking on the grass. I'm really thrilled because Joanna and I met in 2015, I think, or 16, somewhere in that area, that we met up in Pennsylvania, and it was an amazing moment. She's got an official brick and mortar. She's a doctor. She's a researcher. She's a nurse. She's much more than that, because she stepped out of a lot of that and into a higher calling. Anyway, I'm grateful to reconnect with her and find out where she's coming to. Her passion is having people walk in their purpose and perhaps stepping out of the pharmaceutical world as we know it as much as possible. So Dr. Joanna Carmichael from Pennsylvania, tell me who you are in this world, and then we'll talk about a little what you do.
Thanks for such a lovely intro, Charla. It is so wonderful to reconnect with you. And yeah, it's hard to believe it was back in 2015, 2016, but thank you so much for having me on the show. So I am Joanna Carmichael. I'm a registered nurse and a doctor of metaphysics and divinity. I'm also an Ayurveda meditation and yoga teacher. And I have a number of other certifications and different things that I've done. And I'm also an interfaith minister. And I've had a 20 plus year career in pharmaceutical research, and I actually continue to do home care nursing right now, as well as being a transformational nurse coach for people and doing really healing on deeper levels than just the physical. Not that the physical isn't important, it is, but it's all interconnected. And my passion is truly about my platform, which is Pharma to Dharma, going from Pharma to Dharma, and getting people off of pharmaceuticals and back into natural medicine and being in harmony with nature and all that is.
I am so all over that. I'm going to spell Dharma, which is Dharma, and we'll probably do that again at the end, because it literally means finding your purpose, doesn't it? Something along that line.
That's the essence. Yeah. It's got, a lot around it, but that's the essence of it. Yes.
Well, I had never heard that word until I met you. So it's Pharma to Dharma, which means, and you're so on my path, because I want to say that, I'll just say this up here in the beginning, we we have an immune system that's incredible, and our belief system matters. And I've said this for years, and I haven't been to a medical doctor in a couple decades at least. I don't believe in, this is it, I don't believe in getting sick, so I don't get sick. That doesn't mean I don't ever have anything, but it just means that, and it's not arrogance, it's the authority that we've been given. I say this a lot in my shows. Jesus said, you can do what I did and even more, but I wasn't taught that. So if we can heal and we can walk on water, we can move mountains, all those things, if you believe him, that's what he said in John 14:12. So it's not religion at all. It's listening, and it's the authority that we've been given. And so I don't think I had told you that my kids, I have no pharmaceuticals in my cabinet upstairs where I live here. The kids do, but I don't take anything. And in fact, a few years ago, they said, Mom, do you have any Tylenol? I was like,
nope.
Well, they said they found something, this expired like 5 years ago. I was like, I don't believe in it. I don't want to take unnatural things. We've got enough unnatural coming at us with the food sources and all that. Right.
Absolutely. Absolutely. Well, what, if anything, we've been shown in the last several years with the pandemic, and that's not a misspeak. I say pandemic because that's what it is and was. And, there's so many ways we're being assaulted and hijacked, and pharmaceuticals is one of them. And it's big business. They want customers for life. And so sickness is big business. We're in the sick care business, not in the wellness industry, really. Natural medicine practitioners are in the wellness industry because our focus is on prevention. And I don't take any pharmaceutical. I haven't taken a drug or maybe an antibiotic about 40 years ago, for something. And certainly didn't get the clot shot or anything. I want no parts of it. I'm a former pharmaceutical researcher. And so how anybody in their right mind could take something that's untested, wasn't ever proven safe or effective, and was on the market in 6 months is mind-bending to me. And even as a former pharmaceutical researcher, other colleagues and people that I know in the industry who know how to do clinical trials still took the shots.
It's a mind control thing. I mean, it's about controlling us and keeping us divided, scared, in fear, and sick. And then you and I don't watch mainstream news. We get a lot of news and information, but it's not from where mainstream gets, shares real information. It's mind control.
They're bought and sold by big pharma and the farm factory industry and the lobbyists that are promoting all of these things, GMOs, and, nothing in our environment is clean anymore, unless we really make a deliberate effort to find clean things, like filter our water and eat, organic, local, non-GMO food, and keep our devices, we have to use them. They're wonderful in many ways, but it's still EMF, that affects us. And there's so many ways we're hijacked. And I think it's really, really arrogant for anybody or any scientist to think that going against nature is a great idea.
Isn't that nuts?
It's craziness as far as I'm concerned.
I remember learning to wash my hands in elementary school, and they said, you've got good germs and bad germs. You don't want to kill you don't want to kill all the germs. And so as a flight attendant, all those years, I can't tell you what stuff we picked up with our hands, and the immune system that I feel like I've developed over time, partly because of that, right?
Well, absolutely. I mean, when we were kids, what did we get? 2 or 3 vaccines? And now there's like 69 to 79 on the vaccine schedule, including the COVID for over 6 months old now. And it's so disgusting to me, frankly. It's just mind boggling that, just critical thinking and reason and common sense just seems to be lost, and people are asleep. And that was part of the darker agenda that, that kind of perpetuated this whole thing. And, just to see how much we are under mind control. When you're watching a program on TV, you're literally being programmed. And you're in a hypnotic state when you're focusing on, on a screen, any screen, really. And that's the darker agenda, sadly.
Mindless entertainment. It's truly, and I watch, my grandkids are these, I'm like, why are they teaching you to literally take a match and burn an adult showing on TV to burn the kid's hair? I mean, to burn somebody's hair with a match or with a lighter. And I was like, why are they showing that to you? The little 7-year-old said, well, I know better. And I was like, maybe so, but who doesn't, and anyway, the mind control is crazy and it's permeated so young. Before we go too much further, today is October 4th, 2023, and there has been a whole lot of hype around an EBS or emergency broadcast thing with FEMA and FCC and all these kind of things. There's a lot of fear around that. There's a lot of curiosity and unknown around all that. And I have chosen, I'm going to be on the live show during that moment. So if that happens and everything kind of goes crazy, we'll see on the backside. I'm not worried about it, even a little bit. And just to put it out there, it is aware. And I believe if somebody, I believe the good guys are ahead of the bad guys. And if something is meant for bad, that it typically is shifted for good. And I'm pretty sure you're on that same page.
Absolutely.
Right?
Well, and this is all part of I think that whatever is supposed to happen in about 10 minutes, whatever it is, it's a spiritual test. And, when you can stay out of fear and keep your focus on love and compassion and happiness and joy and just live your best life and do your inner work. And that's what I think a lot of this is about, because the brainwashing and manipulation that people have really succumbed to and allowed, that's a choice too. And to be in denial kind of with your head in the sand is a bit of a choice. I mean, when I try to educate and teach people about what's actually going on, even especially I've been in healthcare a long time and have had I know Western medicine from the pharmaceutical world and being an RN, and we're allopathically trained, treat the symptom, not the cause. Don't look at the whole person, just treat systems. There's so many specialists these days. And, to ask a neurologist to take a blood pressure is like you're asking too much, or to expect that you're going to actually get a full physical exam anymore is like, it's you just don't. I mean, medicine today is coming down fast and it needs to. And in Vedic wisdom, the destruction has to happen before the new can occur. And we're kind of done and should be done putting Band-Aids on hemorrhages, which is what, we just had another government shutdown threat. And as we were talking earlier, it's like, bring it already, because, they should put another Band-Aid on another hemorrhage for another 45 days. Whatever that's going to accomplish is just prolonging the agony. And so all the interconnected systems of corruption, the education system, medicine, we know what Rockefeller did, putting the AMA in bed with big pharma a long time ago, that totally took out natural medicine and made it almost illegal for doctors to
they couldn't get funded. The universities can't get funding. The universities cannot get funding if they teach anything natural.
Right.
What's wrong with that picture? Oh my gosh! And that was from the 1800s, the late 1800s, I think early 1900s, within 20 years, not one big university that wanted funding could teach. It happened really quickly. And then do you know, and I think I said this last week with Dave Turner on my show, it's like the white coats it was a marketing thing. So they have the white coat syndrome, so to speak. It's, they
much bigger than blood
authority.
pressure.
It's ridiculous to me.
Yeah. And doctors
how much we sucked into that. And I did too. I mean, certainly in the day.
Well, doctors are put on pedestals. And, when you speak to seniors, more elderly folks, and you try to, get them to make dietary changes or lifestyle changes. I battle this every day with in-home care. And they're on, 5 to 16 medications. And to try to say, change your diet, you're not supposed to take Lipitor with a cheeseburger chaser. You're not supposed to take an anxiolytic drug and drink coffee all day long. It's just common sense. But they've made it so that the drugs become licensed to keep your bad habits going. And then, we have a drug to fix it. And it's a really bad plan. And then when people get really desperate, when the Western model doesn't work or the drug, surgery, or radiation doesn't work, then they might think about natural medicine or looking deeper into the situation. But by then it's too late. If it's a tumor on a lab report, you haven't prevented it, and trying to treat it from that standpoint is going to be much harder. Not that it's not possible, and I'm about integration. I did pharma research for 20 years. We need research. We do need drugs for, emergent situations, but the way we do it is so backwards. So backwards, and nothing about prevention. And what's also mind-boggling to me is that all the side effects that are not reported, and what we are seeing even in the mainstream as far as people dying, athletes dying. I have 10 people on a list that have either gotten sick, gone to the hospital, or died from like turbo cancers, myocarditis, congestive heart failure, who got, all the shots, and no one's making the connection. When that's the only thing that's changed. When you get a rash on your skin, what's the first thing somebody says is, well, what have you changed? Have you changed your diet? Have you changed your detergent? Have you changed your soap or your shampoo or whatever? What's changed? And with a lot of people, nothing's changed. They just got the shot, but they're not making the connection. And I think it's criminal. I think it's absolutely criminal that they're allowed to keep promoting this and now get another one and then say it's free. Well, the other ones were supposedly free when it's not free. Our tax dollars we're paying for it. It's not free. The whole thing, if you can tell, I'm very passionate about it. It makes me very angry to see people violated like that as a medical professional when I went into the industry to help people,
all nurses and doctors, I believe, intentionally go in, the vast majority, to make a difference, to have the heart to serve and help people. And then here it is. You hear it?
Yeah.
National alert.
Oh, how about that? I have my phone off.
I left mine on intentionally because everybody was so scared about it. Wow. So far we're good.
So far, so good. Fine.
Yeah, that's it did come on. Okay. So yay. I mean, I feel like this is a good thing overall. And what you were just saying about I love it that you literally were in that deep into the pharmaceutical industry and chose and something in there, probably you're like, something's not quite right. Why are people staying sick longer and getting sick? And why are we not healing? I mean, and anyway, there's got to be a lot of questions that started you on the path of like, this isn't all it's cracked up to be, right?
Oh, absolutely. I mean, I did psych nursing for a couple of years after I graduated, and then I got derailed into the pharmaceutical research arena quite unexpectedly. And, we were chatting, and I've read and heard other podcasts that you've done, and it's like, how we get to where we are and the stepping stones that have gotten us here. And when you think something is a mistake, it's really not a mistake. It's just what you had to go through to give you more of the wisdom to get you to the next step and the next step and the next step. So I ended up working for 2 drug companies. And then I got tired of corporate politics. So I started my own company when I was 26. And then I ended up working with all of them, all the drug companies. So I was putting patients in drug studies, and I was working on behalf of the drug companies to do monitoring, which is safety and efficacy monitoring of clinical trials to ensure the integrity of research data, which was like very much about safety and adverse events and reporting serious adverse events within 24 hours. There's an ethics review board. I've written hundreds of informed consents, which, have certain elements that need to be included. And, this whole thing with the COVID, that people were put in a drug study without their consent, without their informed consent is really what that was. For an unapproved product. And I really wonder where the ethics committees were, in this whole debacle.
Well, I think everybody seems to be a part of it. The paid, even, we look at the judges even. I mean, we're talking the all of it is so intertwined. And then heaven forbid we talk about trafficking. That's not anything, so that's a whole different ball game. Don't go there right now. But I believe it's so intertwined, and that there's been an agenda for so many years. And you and I were talking about it in 2015, where there were several of us that were gathering and having conversations around this, the systems that have been sold out, 1871, the Constitution, all of that. It's so pervasive. Yes. And what I just, my heart, I can't believe that the vast majority of people that are enmeshed in it did so intentionally. I believe there were some compromise somehow or another. I believe intentions matter. And then sometimes you just get caught in the system.
Yeah, I think, yes, I totally agree with you. As a metaphysician, the power of intention, I can tell you the power of intention is very, very important. I mean, even in clinical trials, your intention and observer effect affects the results of the trial. You can't say exactly how or, in the matrix of how that actually happens, but it's been proven that it does happen. And so, so what happened with me is that simultaneously with starting my research company, I started studying metaphysics. And so I was on this very bizarre, I worked with all drug companies. I did phase 1 through 4 in clinical trials right from after animal testing, it goes into normal, healthy male volunteers, right up to post-marketing. I've done it all in all therapeutic areas. So I started studying metaphysics, and it was a very odd paradox because people were like, well, how can you be a metaphysician and do drug research for a living? I'm like, well, I don't know. I was passionate about both. So it resulted in a doctorate in metaphysics, and then another one in divinity, and then ministry school, and then Ayurveda. And then the more I got into metaphysics, the more I was learning about natural medicine, like Chinese medicine, homeopathy, and Ayurveda is the one that I ultimately fell in love with. But doing pharmaceutical research actually was very rewarding at the beginning because it enabled me to see patients for more time as a nurse coordinator. And so I got to see the mind-body connection up close and personal because in clinical trials, it's mostly placebo-controlled because that's what the FDA requires for approval. And so when you know that a patient's in what's called a placebo run-in before they enter the double-blind phase of the study where the doctor and the nurse know they're on placebo, but the patient doesn't know. And you see them telling you how great the pills are and trying to establish that the patient actually has the disease state that the drug is designed to treat. And they screen fail out because they did too well. So the placebo effect is very important because even the FDA recognizes it. It's like 40%. And so seeing that mind-body connection was very profound for me, as well as that patients got better in drug studies. Patients did well because you actually spent time with them. There was so many, things in place to make sure nothing did happen to them. There were so many safety, you had a protocol you followed. They got tests that were not part of standard of care so that you were watching them carefully and nothing happened to them. And then if something did happen to them, it was highly reportable so that the company and the FDA could decide, do we continue this or not continue this? And death is usually a reason not to continue a drug study. When
back
it happens
in the
to
day.
too many.
Yeah. 5 people and they would pull it. If something, that's not a lot of people, but it's a lot. It's a lot. If it were me, it'd be a big deal. So placebo effect, the book by Dr. Joe Dispenza that I have, and I love this quantum idea, this quantum physics, and that your mind over matter. And I've witnessed it so many times, and I personally, and I know you have too. And when the research is indisputable, right, on what they've been doing with, there's no doubt that mind over matter is a real thing.
Well, I mean, the FDA requires, when you submit an IND, which is an investigational new drug, that's when the drug is going to go into clinical testing in humans. By the time it goes through phases 1, 2, and 3, provided it passes safety and efficacy standards, the FDA wants 2 placebo-controlled randomized trials in order for a company to apply for an NDA, which is a new drug application. But the companies doing the study and paying for it, so no conflict of interest there. And then they could do 10 studies, and 8 of them are garbage, not proving the hypothesis, and 2 are good, and they'll send those 2, and that's okay.
So the FDA,
and the other interesting.
The FDA and the pharmaceutical companies, they are the same. CDC is the same. They're all in the same.
They're all in bed together. And there's a huge revolving door that, I forget who it is at Pfizer, but he's on the board of Pfizer, and he's some FDA advisor too. I mean, it's so corrupt and incestuous. It's
Speaking of that particular, I wasn't going to mention the name of that company, but I saw the CEO of that company, or I'm assuming a higher up in that company, in front of speaking to a WEF banner behind him, literally out of his mouth. I saw a video just about a month ago, said, our goal is to decrease the population by 50% by 2023, which is today, right now. And I don't know when that video was taken, but if that's their goal, duh. I mean, and the whole audience clapped. Decrease the population by 50%. Can I say this? I mean, of course I can say this in my show. So there's a lot of misdirection out there. Did you know that 8 billion people on our planet, the 8 billion people, can fit into the state of Texas land? There's no lack. There's no lack. There is no lack of resources. There's just no lack. And we keep getting, overpopulation and, cows doing their thing and all that stuff.
Yeah. Yeah. I mean, that's a whole nother interconnected, not that there isn't climate change, not that we shouldn't be responsible stewards of our earth. I'm not saying that.
Me too. I watch the water. I'm the most conservative person with resources that I know personally, but I also know there is no lack, and that the abundance it's beyond imaginable. And when we are living in fear, which is what this is all about, fear and divisiveness to keep us small and not united.
Absolutely. Yeah. Well, the how my platform came about was actually a long time ago that I came up with Pharma to Dharma. I was actually, let me back up a little bit. I eventually wanted to leave the industry because I started to see the corruption firsthand. And then I was already a metaphysician. I was already an Ayurvedic practitioner, meditation, yoga teacher, Reiki, everything I was doing and dwelling in both of these worlds. And so and starting to trust much, much more in natural medicine and using pharmaceuticals only as that should be the last resort. And so when I knew I was on my way out and saw corruption firsthand, and I was interviewed on a radio program, and he said, good luck with your new venture and starting a center and everything like that. And I said, yeah, I went from pharma to Dharma, and it just came out of my mouth. And it was like, we both went, and that was a long time ago. And, And so, it's pharma and then moving into my true life purpose. I mean, pharma, we're always in life purpose, and life purpose isn't just about career or your job. Life purpose is being kind to somebody, or, being, everything that you talk about, kindness, a split second that you give a smile to somebody who might be having a bad day. That's your Dharma, being a good friend, being a good spouse, or, not only just what your career is. So to me, people say, well, do you have a church? You're a minister. I'm like, no, I don't have any church. I'm interfaith. I believe in metaphysical laws, not the man-made laws as much. And, it's my ministry is in every moment of every day, 24/7 is my ministry, whoever I come in contact with, and plants and animals included, and that's what how I think we need to live and deal and work with each other. So that's how it evolved to pharma to Dharma. And now my Dharma is shedding light on all of this darkness and trying to get people to wake up, frankly, to wake up to their own sovereignty, because they've been brainwashed, manipulated. I've known this is coming for a long time now, and now it's pretty much here. So when the whole COVID thing started, I had no fear about it. I resisted the masks. I was in medicine and had to do it, and I was bullied about the vaccine. And I'm like, it's not happening. It's just not happening. You'll have to take me out dead before I would take that. And, because it wasn't the popular way, but I stood my ground, and I was never fearful. I continued to see my patients. They were all fine. I boosted my immunity. I stayed healthy, and here we are. And when I see people, it's heartbreaking to me, alone in their car with their mask on. Or now we're starting to see here a lot of people wearing masks, like at the grocery store and stuff like that, or walking outside alone. When we know there's research and data that these masks do nothing for viruses and bacteria, not to mention there's viruses and bacteria everywhere from everything, and the cold, the flu, the pneumonia, and you're breathing in your own secretions and creating bacteria that's going right back into your system. Now, who does that make sense to? So that is really what I'm passionate about. And I think people need to, one of the reasons I'm writing the book is I think people need to know how clinical research is actually done and the drug approval process. And the other thing with the vaccines is that, they're indemnified from any liability, which should, in and of itself, should be a huge clue, because when they're in a clinical trial, there even compensation is available if something happens to them. That's one of the elements of an informed consent. And so for people not, and pregnant women, oh my God, pregnant women are never, ever, ever in a drug study, ever. There's birth control criteria to make sure they don't get pregnant during a drug study. And if they happen to, it's a serious adverse event, and they're followed. And then the child is followed in a normal ethical situation.
I just don't think, I feel like that has all just pretty much gone out the window. I did read recently, and I hope I saved it, Sarah. I'm sure I saved it somewhere, but that now, without really saying anything out loud, all the V words for children, all of them, including the flu, all the stuff, they're actually adding the mRNA or the DNA altering stuff in every single one. And yes. Have you heard anybody say anything about that out loud? Not really. It just is so big. We can't even conceive of how big all this is, and how exciting for me to know that you come from both sides. You have the capacity to speak to it, just like perhaps Dr. Mikovich, some of these other people that have actually been in those situations and have spoken out. So you've got a platform, girl. We've got to get this word out there. But
yes, absolutely.
I'm excited about what you're doing, and when are you going to get that book out? Zig Ziglar, every time you saw him, he said, "Have you written your book yet?"
I'm targeting the end of the year because it's been in process for way too long. But, I also believe in divine timing, and that when the timing is right, I've just disciplining myself for a daily time to write or a weekly time to write. I really don't work like that. Like, I work kind of well under pressure. And then what'll happen, like when I wrote my PhD thesis, it was like, once I got started, I didn't stop. I wrote all day, all night, for days. And that's the way I turn things out. And I think when I get into that rhythm and start to pull the pieces together, I think once I start, I will end up finishing it very, very quickly. Because it's
no doubt about that. I agree with that. I'm kind of that same way. It's like, I can't. Okay, I'm going to write for 15 minutes. It takes me 5 minutes or 10 minutes, 15 minutes to get what pen I want to write with. I mean, it's just silly.
Exactly. I just, I think also, I mean, we have to look at everything with a great deal of compassion and a great deal like an eagle on a perch, and with a great deal of detachment, because I know that I am very passionate and I get very angry, admittedly. And I am working on that, because when I'm using my energy to be angry, I'm not using it to help anybody, especially myself. And so I think, the people that are making those choices, and I have to keep reminding myself, and my friends who are, with me spiritually remind me, and we remind each other that, the soul chooses a path before it gets here. And so we all have a Dharma and a purpose. And those souls' purpose might be to get sick, to leave, to show us, to show us. And while that's I truly believe that's metaphysically true, it's very heartbreaking, because when it's your family and your friends and you're watching them go down a path that, or I watch a patient go, like a patient asked me to take her for a COVID vaccine. And I'm like, oh my God, I'm in an ethical dilemma now, because if I take her and something happens, I'll never forgive myself. And then on the other hand, it's her choice. And I am for medical freedom. I truly am for medical freedom. It's like, if you want it, okay, then take it, but do your homework and whatever, but don't ram it down my throat, make me take it. My body, my choice applies to this too. And that's another, thing that's, kind of very distorted, with the whole abortion issue. My body, my choice. But yet when it came to the vaccine, they were allowed to mandate it. It's just, it makes no sense. And people really didn't make the connection.
Speaking out of both sides of the mouth and having zero common sense. I made a little course a couple years ago now. It's called Nana Says. So it's like, let's teach our children critical thinking skills, common sense, manners, and respect. Those it was like, how can we do that? And I mean, I was like, hey, I love you too much to not call you out when you're disrespectful. I love you too much not to limit your screen time. And it's a pretty good, I mean, the little grandson wanting to learn how to cut an apple with a sharp knife. And I was like, okay, look, a critical thinking skill is like, what could happen? Would it be life-threatening? Do you think you would have to, whatever? Do you need stitches? Think through. You want to crack an egg. Okay. How are you who's going to clean up the mess of it? Whatever. Right. Little things, but they can learn to think through rather than just I feel like we're raising zombies. If you walk around into some of our big box stores, you might think that we've become zombies. And I really believe they're so pharmaceutical, they're so medicated. And then, and entertainment has become the highest value. And I live in a situation that I feel like that's the case. What do we eat? What do we do? What do we play? What do we, what do we watch? So our values have shifted. And I think that it's time for those of us, there's millions and millions of us that are feeling this way, know this stuff. And now that we're speaking up a little bit about it, it seems like it's the tipping point. We've got, if we can have if everybody said that I love you at the same time, the whole world would be a whole new place. I believe, it's like, right. So It's a mindset. And when you were doing what you're doing, and where are you? How can people find you? Because we're coming up, this time goes fast, right? So
It goes so fast. Well, I actually don't have my center any longer, and then in a way, I closed it in time before the whole COVID thing happened. So I do everything online and have private clients. I do transformational nurse coaching I do it on Zoom. You can find me on vedicalchemy.org or pharmatodharma.com. So, it'll lead you to the same place. I've got a 90-day transformational coaching program that people can book a call with me to see if it's a fit. But I'm really being very, very careful who I take, because I want people who want deep transformation. I don't have the time, the money, the energy, to convince somebody to be well if they really don't want to be well. And mindset, absolutely mindset. And, what you think, it all starts in thought. Metaphysically, everything starts in thought. And people, sadly, and I'm almost sorry to say this, they want to keep their illnesses. Some people just want to keep their illnesses and be victims, and then expect the quick fix to take care of it so they can continue their bad habits or their bad relationships or their bad job or whatever situation is making them unhappy, and continue to be victims rather than. And I want to empower people. If they need to leave a relationship, leave a job, leave a bad situation, stop eating junk food, stop drinking alcohol or doing drugs, and they really want to change that, they have the power to change that. And then I work on other levels like superconscious transformational healing, which is definitely quantum levels and has to do with the unconscious beliefs that could be in, as the operating system behind the conscious thoughts. And so I'm a big meditator. I teach people to meditate first thing and then work on these levels with superconscious transformational healing or past life regression or hypnosis. I do all that, depending on the client. And it's very individualized, unlike allopathic medicine. You have arthritis, you treat this for this. You have heart disease, you treat this with this. And, it's in Ayurveda, there's different types of arthritis. And depending on the energetics of the person and the way the disease is manifesting, the treatment's going to be different. So, one person's poison is another person's nectar, as it is really in everything. And in Ayurveda, we not only digest our food, but we digest our experiences. And, we have to do something with that energy. And every illness there's an emotional, spiritual component, even if people think there isn't. They might come to me for a physical issue, but there's always an emotional component. And that's driving it, unprocessed grief, unprocessed trauma. And when you don't process those things, deal with them, mentally, emotionally, spiritually, the energy of those things has to go somewhere. So it creates heart disease and diabetes and arthritis and cancer and things like that. So sometimes these illnesses, if the person is conscious, they can look at it as an invitation and a message to say, hey, look at this. And then tremendous, transformational healing can actually occur on all levels.
And so this year I've committed, and I would say probably maybe missed 5 to 10 days, but I meditate every single morning almost this year. Some from 5 minutes to 3 hours. I mean, there was a couple times like, whoa, so it's a long time. And it is beautiful people think that's, some people in the religious world, the bondage of religion world thinks that is woo-woo. But, prayer is talking to God and meditation is listening. So I think a lot of people have misconstrued that. And it's made a huge impact in my world too.
How do they think the prophets and the saints and the the disciples? How did they were channelers? They were. How did they think the information got downloaded?
Well, but that but if we can do that, then they can't control us so much, right? If we can do all things that Jesus did and even more, then how can they control us? And so that divisiveness has been going on for decades, centuries now. And so for those of us waking up to that and I came out of the traditional, fundamental religion, and I can't, I mean, like, why is my preacher and my religion the only one that's right, and you're the rest. I mean, so it's a very, religion literally means return to bondage. I say it often because I don't think people have a clue that that's the case. God doesn't have a box. He is love. He can't be not love. And that's what our message is. And so pharma.com. Okay. PHARMATODHARMA.com. And Vedic alchemy, which is another interesting thing to spell. And because this will be on podcast, it's probably worthwhile spelling it. So do you want to spell that?
Sure. V is in Victor, Vedic, VEDICALCHEMY.
.org. Okay. So it's good to, I know my name, Charla, a lot of people don't, it's like charlaanderson.com, but it's CHARLA. So it's when we're listening, we don't always catch that. So I really like to emphasize if it's not really, really clear. So I am grateful more than you can imagine to have this conversation. I'm so happy to know a human being that I personally know that has really gone from that side to this side. And I think it's really a challenge. I have friends that are doctors and they're like, think that they're doing the right thing. They've been taught strictly that method, and I don't think their intention is bad, but they don't have. They've chosen to ignore. Perhaps I don't mean that ugly, but just there's so many. We only have so much time, and what we learn and what we read and what we think comes from.
Well, it's
usually outside sources.
It's a lot of indoctrination. I mean, as a nurse and how we're trained in nursing school and medical school it's an indoctrination. And when you ask many doctors, now I believe most are well-intended and that they went into the profession for the right reasons. But then there's something very seductive, about more money for prescribing drugs. I mean, chemo drugs are sold to patients. So do you think there's no incentive to prescribe them? And I've lost more friends to the treatment than I have the cancer. So,
way back when we met, I was saying if we would take the C word out of our vocabulary, there would be less of it. And this is something huge, that quit claiming it. You might be diagnosed. Say I'm diagnosed. I am is critical. What you say after that is who you are. So when you claim it, you're internalizing it. So when you say, well, I've been diagnosed with this and I need to deal with it, but don't say it's who you are and what you have. I mean, isn't that amazing?
Oh, I totally hear you. I am a diabetic. I am a cancer survivor or whatever with the word in it. The words are extremely powerful, and I am are the two most powerful words that you can say. And so I just try to ask people to rephrase it and say, I have diabetes. I have high blood pressure.
I've been diagnosed with it is even better than instead of having it is still almost claiming it. So even AA. So I am an alcoholic. I think that I know so many people that have been helped with that. However, what if they said, I am powerful beyond measure. I am healed. Whatever. But to me, that just keeps you enslaved. And so you become addicted to meetings rather than, or something like that. I don't know. We get way off path here, but words matter.
Words matter, thoughts matter, words matter. And does it take work? Yes. It's about inner vigilance. And the more you meditate, the more you become conscious of those unconscious programs running in the background. And people really need to get more emotionally intelligent, more spiritually intelligent, and get back to self-inquiry, because all that's happening on the outside is not even the real reality. It's just what we've collectively agreed to go through right now. But what we can do for ourselves individually is reclaim our sovereignty, where we stand our ground and we have no fear, and we're not manipulated by all these different propagandized agendas going on. And it makes me really sad to have to, and I, in Western medicine, I still have to be in that model. And frankly, it's, I'm on my way out, because I can't, I'm doing drug boxes for people and encouraging this. And even when I try to ask a doctor, well, don't you think, could we use something else? Or their cholesterol's fine. Do they really have to be on a statin? Oh yes, the literature and blah, 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 blah. And it's not true, but you can't convince them. Or, oh, ashwagandha hasn't been, there are no peer-reviewed studies. There actually are, and it's 6,000 years old, but they don't want to, I'll go with the 6,000-year-old, philosophy.
In old wives' tales. I mean, you said all those other things earlier, and I was like, yes, in old wives' tales, most of them are true. They really have some benefit, baking soda and vinegar and, just the things that we can have around the house that are so much better.
And are cheap and expensive, just like hydroxychloroquine and ivermectin. They're cheap and they're effective, and they schmeiss those right out of the gate and hurt those doctors who were speaking out, who knew how to treat patients. I mean, how do you tell a patient, don't do anything? You're sick, don't do anything, and go home or come to the hospital when you can't breathe, and then put them on a $32,000 ventilator that Medicare is going to, pay for. I mean, it's so, we're
on the same page. We're going to have to just kind of cut it off, because we could go on all day for 2 weeks. I mean, this is my conversation, and it's your conversations, our passion to just have people speak what they want, not what they don't want, and to be clear, and to know that there's another way if they choose. And I don't walk in judgment around any of that. It's not like, yes, I understand that you have a headache and you want to take something or whatever, you've got this or that. But what if you went out and laid in the sun and got some vitamin D and breathed deeply and all of those things.
Look what we were deprived of when they locked us down. I mean, it ruined the economy. It hurt people's health more. We were deprived. I wasn't, because I did what I wanted. I wasn't going to be, told when I could go here, when I could go there, where to stand in a grocery store. It was the most ridiculous thing I ever saw in my life. And, deprived of vitamin D, the sunshine, people couldn't go to the beach, and fresh air, and mask up as you're outside. And then people got crazy and telling on each other. I mean, what it did to people and their relationships is just,
and how fast it happened. I mean, oh my gosh, it was like warp speed. Well, Joanna, I am going to just bless you and thank you so very, very, very much for joining me. I think we've got a posse out here that's really changing things, and you're certainly on the front lines of that. And if there's, we'll have to do this again. You're beautiful, you're fun, and
we'll talk about something
we're making a difference.
Yeah.
We'll talk about what?
We'll talk about something fun next time.
Well, the fun part of this is that maybe one person or two, 5 people will go, I haven't tried meditation. Maybe somebody will hear something that's the point, right? It does. I have a saying, we can't change the world, but we can change our world, which changes the world, right? So,
and we never know how just one short interaction. I've been very surprised by people, and very surprised that when I'm trying the hardest to convince somebody or get them to make a change, that's not when it happens. or when something I say in passing made all the difference and I wasn't even thinking about it. So I think we just need to keep having the conversation, help to wake people up in a loving and compassionate way. And my services are an invitation to meditate. I teach meditation, Ayurveda, yoga, and spiritual principles, metaphysics, and I'm very passionate about people getting off of medications, because keeping the drug companies in business is not what we should be doing. We should be voting with our conscience and our dollars.
Exactly.
Well,
thank you. And just keep smiling, keep pushing, keep hugging people, and candy bar hugs. I'm like, I'm tired. I didn't like elbow bumps, so the crazy stuff we've survived. And we are thriving, and we are blessing humanity with our message. And thank you for coming along and joining me on the Charla Anderson Show, collector and connector of fascinating people, and everyone is fascinating. Thank you so much. And I always like to choose, you're perfect exactly who and where you are. And there's nothing you can do to be loved more or less by God or by me, just be, and you are perfect. And so I always end with my special message of choose joy.
Parting is such sweet sorrow. The Charla Anderson Show, encouraging you to stand strong and courageous with bold faith, no fear, immense hope, kindness, and love, especially towards yourself. Visit charlaanderson.com for replays, blogs, and more on her ever-expanding website, as well as watch her live TV show on winwinwomen.tv, Roku, Apple TV, and Amazon Fire. And so that we can continue learning together and growing this community of beautiful souls, we invite you to share the Charla Anderson Show with your circle of friends. Until we meet again next week, remember always, choose joy.